So start.
So, good evening, friends. Today we are presenting you with the cupping therapy session, and we have with us Dr. Vishal Jain. Good evening, sir.
Good evening, good evening, good evening all.
So, Dr. Vishal Jain is the vice principal of JHCP College, and he has a past experience of almost 17 years of teaching. So, Dr. Vishal will be sharing some of his experiences about a much discussed topic, which is cupping therapy. We had a lot of requests from our viewers कि अगर सर कपिंग थेरेपी पे कोई वर्कशॉप हो सकता है, कोई सेशन हो सकता है, and we are glad that Dr. Vishal has agreed to do a session with us. And the best part is Dr. Vishal has agreed to do a basic session for cupping therapy in which he will be discussing how cupping therapy works, how exactly things are. And Dr. Vishal is graciously not charging anything for his session, and he just wants everybody to learn about it. So moving ahead, we will just take it forward. Vishal sir, please you can start.
Okay. Hi guys. It's definitely my for this session is basic session as written on the flyer and all is a very basic session. But my aim and my motive for today's session maybe half an hour, maybe 45 minutes doesn't matter. Fine. I will give you something that from tomorrow onwards you will start in your clinic. Something that see it's a use science. A cupping therapy is a use science, right? But first of all, last from 10 years, almost 10 to 11 years, I am doing workshops. I am started as a workshops on manual therapy, mobilization, manipulation, and all, and like that. Fine. So I am giving a 5 minutes about myself. Yeah. After after I started a manual therapy, as I am a student of NIRTAR, there is a National Institute. Most of you know about that NIRTAR. What is NIRTAR? Is this? It is the hub of, you can say, it's a temple of manual therapy. Like, so it's inside me to do something manual therapy. But as I grown up in the field of physiotherapy, I learn most of things by teaching and learning from my friends also. I come that point that there's a why grading system of mobilization. I'm a bit of a mobilization. I'm just talking about the mobilization. Why grading system? Why we are talking about grade 1, 2, 3, 4? You know that nowadays grade 2 plus 2 minus 3 plus 3 minus, there are few of space. There are few of space in a joint. How can you calibrate it? It's very tough. I don't know why the Australians are doing like this and all, but it's very tough. So my aim is that why not we are playing with the symptoms, stiffness, tightness, fine, joint pain. So we are doing. So I started a no grading system, a manual therapy, mobilization or manipulation or no grading system. Just watch out, just assess, proper assessment of the symptoms, what the is pain is there, pain with symptoms, pain with stiffness and whatever. So it is like that. Same as for cupping. See, I am doing workshop on mainly three top, rigid taping technique, cupping therapy and muscle energy technique. Because this is a result oriented. Now the era of the time of it's an ancient time when the people are talking about the physiotherapy is slow giving process is so I am choosing these kind of techniques to making the people to imparting my skills to others to learning and all like same as cupping. See, and now gradually I am switch over the cupping. Moreover, first of all, I am merely I will show any PowerPoint to you. See, the reason is a small time. I am with you people. So maximum what I am speaking, you just grab it, keep in your mind like and maximum what I will demonstrate you just learn it. Don't be think that okay fine I will share my screen to you for the PowerPoint and all. No, whatever you learn it like that. Fine. So it is about that. And my concept of workshop is not like that. Okay fine, it is my pattern. I will teach you this thing you have to do, you should do in your clinical practice like this only. No. Give your basic concept. Want to clear your concept. I am very happy. After that onwards you will start your own way to teach by the basic of workshop, with the basis of workshop. Like for example, I am applying rigid taping technique for a trapezius like this. No, it's all why we are doing taping for trapezius? What happened with trapezius? Why we are doing taping for the trapezius? This is the main concept. This is the main key concept of my workshop. Fine. So I talk about the taping about like the trapezius pain about for 5 minutes. What happened? The pathomechanics. Why we applying a taping by this manner? Because after few days you forgot my pattern of taping, but you remember a logic. What logic? Why we applying? Why we applying a taping for that condition? How? The concept. So this is my main aim, my motive for my workshops like this. It's not like that, okay, fine. This is the way of cupping. Same as for cupping. See, cupping is not physiotherapy. First of all, in my each and every workshop, my first statement is cupping is not physiotherapy. It is an encroachment, is an adaptation of someone else technique. Someone else technique, not someone else technique, someone different pathy. Like cupping, we physios find something related to our patient. Okay, fine. We will apply this kind of cupping technique to our patient, like joint pain, muscle pain. We give benefit to it. That's why we started we using cupping therapy. Same as for dry needling is a basically a acupuncture technique. But we are not the master of acupuncture, so we extract the things where we give relief to our patient, like for the acupuncture, same as for cupping. Fine. You know that in spa cupping are using in spa cupping are using in normal scenario in each and everywhere cupping are using, but how they are using is something different. Why we are how we are using something different. Suppose for the example, maximum all of you people who are watching, you are doing this kind of this webinar today, might be you people are using cupping, you learn from someone else is good. If you are watching on YouTube or some other videos and all, you are not learn with the learned person basically. So what is this is simple, apply the cup over there, doing the cupping is no, it's not cupping, because we are physios. We treat acute cases, we treat chronic cases. So we need a dosing. Fine. You can't apply a simple cupping technique as I discussed right now, simple cupping for the acute phases, for the chronic phases, in the joint, in the muscles. No, no at all. So this is changed, modification of the basic cupping is given by someone else, is what is the whatever the someone other country like that. So in physio, I converted, I modified 90% of cupping technique for physios for ourselves, because we are doing something different. Fine. It's not like that. Okay, fine. Apply the cup, giving the cupping gun and all. No, no. So last from 4 to 5 years, I am converted 90% cupping techniques for our like for example for our profession like this. Fine. So basically, it is an encroachment of someone else technique for our benefit. Like this is a cupping technique. Okay, fine. What is cupping? We are using cup. It is known as cupping. Fine. But exactly what we are doing it? What we are doing it exactly, we are providing, see, we are providing a negative pressure, a vacuum. We are providing a negative pressure or vacuum inside the cup. So what? It is a basic line statement. Providing a negative pressure over the treatment area is called cupping technique. I am talking about dry cupping. I am not talking about wet cupping. Be clear. I am talking about dry cupping. I am not talking about wet cupping. Fine. So to create or to develop or to provide a negative pressure, we need some chamber, some cavity. We need some chamber or some cavity, or we need some process or some instrument that will provide a vacuum inside the cavity. Okay, fine. How? 3000 before Christ. 3000 before Christ, the cupping therapy start maybe in Egypt or Greek. It is a controversy. It started from the Egypt or started from the China. It is a controversy, but maximum research suggests or evidence suggests start from the Egypt. How they started? They started from the bleeding disorders, menstrual cycle disorders to correct like this. Snake bite, to correct the snake bite. Okay, fine. How the correct the snake bite? They using the cupping and all. if we go for 20 years back in 80s and 70s, our Bollywood, if we talk about the Bollywood movies, okay, a snake is coming, the bite to the actress, the bite to the actress, fine, hero come, they suck that bite part venom inside the oral cavity, inside the oral cavity spit out, inside the oral cavity venom suck out and spit out, fine. What is it? It sucks something. How to suck something? When you're getting out something from inside to out, it create a negative pressure. So oral cavity is a chamber, as I talk about that, where we create a negative pressure. Now, second part, how to create the negative pressure? How to create a negative pressure? By this, by sucking inside the oral inside the oral cavity, fine, inside the oral cavity, like so. What are the process? Your deep inspiration, is create a negative pressure inside the cavity, the oral cavity. This is the whole process, is the cupping. As the cupping started in Egypt, as the time started gone on, evolution gone on, like that, they initially they used bamboo cups. Initially they used, okay, fine. Okay, fine. I'm going to in the Hindi, like that. Okay, fine. I can go with a mix up. Okay, fine. Just a moment. Just a moment. फाइन. सो क्या होता है, हम एक नेगेटिव प्रेशर क्रिएट कर रहे हैं चैम्बर के अंदर. हम हमको एक चैम्बर चाहिए होता है और नेगेटिव प्रेशर को क्रिएट करने के लिए एक इंस्ट्रूमेंट चाहिए होता है. जो भी आपको मैं वेनोम बाइट की बात कर रहा हूँ, स्नेक बाइट की बात कर रहा हूँ, उसमें हम क्या करते हैं, ओरल कैविटी इज अ चैम्बर और हमारा डीप इंस्पायरेशन प्रोसेस होता है. इट विल क्रिएट अ नेगेटिव प्रेशर, इट विल सक आउट समथिंग like this. So this is a whole process is known as cupping. So initially in Egypt, they use first oral cavity, but as the evolution started, जैसे जैसे evolution चलता गया, they initially they use a bamboo cup, फाइन, बांस के बने हुए कप वो यूज करते थे, ठीक है. बट हाउ दे स्टार्टेड, एज द जैसे जैसे फायर होना स्टार्ट हुआ, लाइक स्टोन से घिस के फायर करते थे, यूज ऑफ फायर इनसाइड इट, द फायर कपिंग स्टार्टेड, लाइक तो व्हाट इनसाइड दैट चैम्बर. बट फायर कपिंग नॉट लाइक दैट, फ्लेम किया, लगाया, कप लगाया, हो गया. नो नो नो, ऐसा नहीं होता. फाइन. सो बट बैम्बू में क्या होता था, बैम्बू यूनिफॉर्म नहीं होता है. बैम्बू क्या होता है, वो यूनिफॉर्म नहीं होता है. बैम्बू के अंदर क्या होता है, अंदर अंदर स्पेसेस होती हैं, तो वो जो फायर लगाते थे या वैक्यूम क्रिएट करते, वो इजीली बाहर निकल जाता था, वो इजीली बाहर निकल जाता था. आफ्टर दैट दे स्टार्ट सिरेमिक, फाइन, क्ले, सिरेमिक, फिर ग्लास, फाइन, क्ले, सिरेमिक के कप बने, ग्लास के कप बने, मेटल के कप बने. बट मेटल में क्या प्रॉब्लम आती थी, गर्म हो जाता था बहुत जल्दी, क्योंकि उस टाइम एक ही टूल होता था वैक्यूम क्लियर करने का. या तो वो ओरल कैविटी से करते थे, पर कितना करेंगे उसमें, या फिर वो फायर यूज करते थे. तो मेटल का डिसएडवांटेज क्या था, वो गर्म हो जाता था, ठीक है, डिस्कार्डेड, उसको हटा दिया गया. तो उसके बाद में जब इवोल्यूशन मतलब सिविलाइजेशन होता चला गया, इवोल्यूशन होता चला गया, तो इवोल्यूशन होता चला गया और वो होता चला गया, तो फिर प्लास्टिक के कप बने, फाइन. प्लास्टिक के मोर फैब्रिकेटेड होना स्टार्ट हुआ, मोर फाइन प्लास्टिक के कप बने. तो लेटेस्टली हम जो कप यूज कर रहे हैं, अभी हम ये वाले कप यूज कर रहे हैं. दिस इज अ डिजाइन ऑफ द नॉर्मल इजी नॉट इजीली ब्रेकेबल कप्स होते हैं, प्लास्टिक के बने हुए होते हैं, फाइन. ये कप होते हैं डिफरेंट मल्टीपल साइज के आते हैं, लाइक फॉर द एग्जाम ये साइज है, उसके बाद में सबसे बड़ा साइज कप का ये होता है, फाइन. दिस इज अ कप साइज. और सबसे छोटा कप साइज जो होता है, वो ये होता है फॉर द स्मॉल जॉइंट. इससे छोटे भी होते हैं, फॉर यू कैन गो फॉर पीआईपी एंड डीआईपी जॉइंट्स के लिए बने हुए होते हैं. तो ये कप यूज करते हैं, ठीक है. अब इस कप के अंदर वैक्यूम कैसे क्रिएट होगा, तो उसको वैक्यूम को क्रिएट करने के लिए वी यूज दिस पिस्टल. तो वैक्यूम को क्रिएट करने के लिए हम ये कपिंग गन या वैक्यूम गन को यूज करते हैं. आई विल जस्ट डिमॉन्स्ट्रेट यू फॉर हाउ टू यूज इट. तो ये कपिंग गन होती है, ये लीवर होता है, इससे वैक्यूम क्रिएट किया जाता है इसमें, ठीक है, लाइक दिस, फाइन. तो दिस इज कॉल्ड हाउ टू स्टार्ट इट. नाउ बेसिकली cupping कपिंग दो पार्ट में डिवाइड की गई है। कपिंग जो है वो दो पार्ट में डिवाइड की गई है, ड्राई कपिंग एंड वेट कपिंग। आज हम ड्राई कपिंग के बारे में बात कर रहे हैं। वेट कपिंग जिसे हम हिजामा बोलते हैं, इट्स समथिंग एंटायरली डिफरेंट इशू, डिफरेंट कॉन्सेप्ट। उसके बारे में आज मैं आपसे बात नहीं कर पाऊंगा। फाइन। सो व्हाट, कपिंग दो पार्ट में डिवाइड की गई है, ड्राई कपिंग और वेट कपिंग। ठीक है। अब ड्राई कपिंग ये दो पार्ट हो गए। अभी हमने जितना डिस्कस किया वो ड्राई कपिंग के बारे में डिस्कस किया, राइट। अभी आप मुझसे सुन लें, फिर मैं एक एक करके आपको डेमोन्स्ट्रेट देना स्टार्ट करूंगा। अब ड्राई कपिंग के दो पार्ट होते हैं, स्टैटिक एंड डायनामिक। ड्राई कपिंग के दो पार्ट होते हैं, वेट कपिंग के नहीं होते हैं, वो अभी हम बात नहीं कर रहे हैं, एंटायरली डिफरेंट सेक्शन है। ड्राई कपिंग के दो पार्ट होते हैं, स्टैटिक एंड डायनामिक। स्टैटिक एंड डायनामिक का मतलब क्या होता है? अगर आप कप को लगा के ऐसे छोड़ देंगे, अगर आप कप को लगा के ऐसे छोड़ देंगे, फिक्स कर देंगे ओवर द ट्रीटमेंट एरिया, उसको हिलाएंगे नहीं तो वो स्टैटिक हो जाएगा। अगर आप कप को मूव कर रहे हैं ओवर द ट्रीटमेंट पार्ट, अगर आप कप को मूव कर रहे हैं ओवर द ट्रीटमेंट पार्ट, तो ये डायनामिक हो जाएगा। मतलब मूविंग मूविंग आपने बहुत से फ्लायर में देखा होगा, बहुत से लोगों को देखा होगा, मूविंग कपिंग मसाज। मूविंग मसाज व्हाट इज दिस इज अ नॉर्मल सिंपली, अगर आप कप को मूव कर रहे हैं ओवर मसल्स के ऊपर, डिफरेंट लॉजिक है, बहुत सी बातें ध्यान रखनी पड़ती हैं इसमें। और आप कप को अगर सपोज ट्रीटमेंट एरिया के ऊपर ऐसे मूव कर रहे हैं, लाइक फॉर एग्जांपल ये ट्रेपीजियस है, सॉरी टेनिस एल्बो का केस है, राइट। यू आर अप्लाइंग दिस थिंग दिस वे, यू आर अप्लाइंग दिस वे, तो ये सर्कुलर वे या लीनियर या वॉट एवर जिगजैग वे में अगर आप उसको मूव कर रहे हैं, तो यू आर मूविंग द कप ओवर द ट्रीटमेंट एरिया, दैट इज कॉल्ड डायनामिक। सिंपल सा one point should be remember, the the periphery of cup, the circumference of cup should be properly touch or fixed with the treatment area। ऐसा नहीं है कि कप का जो ये एक हल्का सा हिस्सा जो है वो स्किन से बाहर निकल रहा है तो वैक्यूम क्रिएट नहीं हो पाएगा। ठीक है। देखिए कप के ऊपर नंबर लिखे रहते हैं, कई कुछ कप के ऊपर अल्फाबेट लिखे होते हैं। जैसे मैंने जो कप पकड़ रखा है इसके ऊपर 03 नंबर का कप है। ठीक है। सी ये हमारे लिए ये मैन्युफैक्चरिंग पॉइंट ऑफ व्यू से है। ठीक है। हमारे लिए कप साइज क्या है? सपोज मैं बोलूंगा भैया 3 नंबर का कप लेकर के आओ, व्हाट इज दिस? अगर 3 नंबर का कप, ये जो कप में की बात मैं कर रहा हूँ, अगर मैं टेनिस एल्बो पे लगा रहा हूँ, मेरी एल्बो पे फिट ही नहीं हो रहा है, मेरे पेशेंट की एल्बो पे फिट ही नहीं हो रहा है, तो क्या काम का है? सो the cup size or the periphery of cup should be exactly fit with the treatment area। ट्रीटमेंट एरिया के ऊपर प्रॉपरली फिट वो होनी चाहिए, वही कप साइज एक्चुअली होता है, राइट। तो कपिंग स्टैटिक एंड डायनामिक, सॉरी कपिंग जो होती है ड्राई कपिंग और वेट कपिंग, ड्राई कपिंग दो पार्ट में डिवाइड की गई, स्टैटिक और नॉर्मल, और मूव कर रहे हैं तो वो डायनामिक है। कप को एक्चुअल कप साइज क्या होता है? जो आपके ट्रीटमेंट एरिया पे प्रॉपरली फिट हो जाए बिना कोई स्पेस छोड़े हुए। ठीक है। चलो हम कप की बात करते हैं। ये रेड रेड जो आप देख रहे हैं, ये रेड वाला पॉइंट जो आप देख रहे हैं, ये वॉल्व होता है, ये कप का वॉल्व होता है। इसके और ये जो होता है, ये जो होता है ये कप की बॉडी होती है, ट्रंक, और ये पेरिफेरी होती है, सर्कमफेरेंस होता है। ठीक है। लाइक कप को पहचानने का तरीका क्या है? सी मल्टीपल कप्स अवेलेबल है, मल्टीपल रेट के कप्स, प्राइस के कप अवेलेबल हैं। बेसिकली जब आप कप लेंगे तो कप का जो ये पेरिफेरी है, ठीक है, सी इतना जल्दी कप टूटता नहीं है, एक आध बार नीचे गिर भी जाएगा तब भी नहीं टूटता। इट्स नॉट इजीली ब्रेकेबल लाइक दिस, फाइन। बट क्योंकि कप का ये पेरिफेरी सर्कमफेरेंस वाला पार्ट जो है वो पेशेंट के कांटेक्ट में आ रहा है, दैट शुड बी स्मूथ। ये बहुत ही स्मूथ होना चाहिए, रफ नहीं होना चाहिए, खुरदरा नहीं होना चाहिए, रफ नहीं होना चाहिए। अगर होगा तो आप कप को लगा रहे हो या डायनामिक कपिंग कर रहे हो तो वो स्किन में एब्रेशन कर देगा, स्किन को छील देगा वहां से। मेन थिंग ये है, जो भी आप कप सेट लें कहीं भी किसी से भी, तो सबसे पहले इसकी ये जो पेरिफेरी है, सर्कमफेरेंस है, ये स्मूथ होना चाहिए, ये यूज करें। ठीक है। कप को कभी भी हम बेयर स्किन पे नहीं, सी मैं बोलता चला जा रहा हूं, मैं आपको की पॉइंट देता चला जा रहा हूं। मैं अपनी वर्कशॉप जब करता हूं उसमें ये सब बेसिक चीजें बोलता हूं स्टार्टिंग में, वो सब मैं आपको बोल रहा हूं। और ये बेसिक चीजें ही हमारे ट्रीटमेंट को एनहांस करने में, परफेक्ट बनाने में हेल्प करती हैं। क्या है, ऐसा तो लगाना है, कोई बात नहीं, चलेगा नहीं, ये सब नहीं चलता है। कप को कभी भी बेयर स्किन पे नहीं लगाते हैं। व्हाट इज द मीनिंग ऑफ बेयर स्किन? वी नीड सम ऑयल, कोई सा भी ऑयल चलेगा, कोकोनट ऑयल, ऑलिव ऑयल, कोई सा भी ऑयल चलेगा, ठीक है, पर लुब्रिकेशन, लुब्रिकेशन ऑयल के फॉर्म में चलेगा, लेकिन जो लुब्रिकेटिंग क्रीम्स आती हैं, मॉइस्चराइजर क्रीम्स आती हैं, वो नहीं अप्लाई करना है। सिंपल जो ऑयल है, चाहे वो कोई सा भी ऑयल आप यूज करते हैं, फ्रेग्रेंस वाला है या नॉन फ्रेग्रेंस वाला है, बहुत से लोग वर्कशॉप में ऐसा बोलते हैं ये फ्रेग्रेंस का ऑयल होगा तो इतना अच्छा हेल्पफुल करेगा, ऐसा कुछ भी नहीं होता है। सी इज समथिंग डिफरेंट। आप नॉर्मल सब वो क्या पता आपके पेशेंट को फ्रेग्रेंस समझ में नहीं आ रही है, अच्छी नहीं लग रही है, तो इट विल क्रिएट समथिंग साइकोलॉजिकल इम्पैक्ट फॉर द ओवर द ट्रीटमेंट लाइक दिस, फाइन। सो वी शुड, हम क्यों ऑयल यूज कर रहे हैं, हम बेयर स्किन पे नहीं लगा सकते हैं क्योंकि हम स्किन के कट होने के चांसेस ज्यादा होते हैं, इसलिए हम बेटर कप स्किन के ऊपर फिक्स हो जाए इसलिए हम ऑयल लगाते हैं, ठीक है। और जैसा कि हम अपने नॉर्मल फिजियोथेरेपी ट्रीटमेंट में हमेशा करते हुए आए हैं, क्या करते हुए आए हैं, स्किन को पहले साफ करते हैं, डस्ट फ्री करते हैं, सलाइन वाटर से उसको क्लीन करते हैं, वो सब हमको करना है। जिस एरिया में आप कपिंग कर रहे हैं वो एरिया हेयर फ्री होना चाहिए, वहां पे कोई भी बॉडी हेयर नहीं होना चाहिए, पहले ही पेशेंट को आपको एक्सप्लेन करना पड़ेगा, अदरवाइज हेयर फॉलिकल पुल होने के चांसेस होते हैं, हेयर फॉलिकल पुल होने के चांसेस होते हैं, क्योंकि कपिंग कैस कपिंग की जो फिजियोलॉजी है वो किस पे बेस्ड होती है, कपिंग की फिजियोलॉजी होती है कि हम जब कपिंग स्किन के ऊपर जब कप लगाते हैं और वैक्यूम देते हैं तो स्किन पोर्स ओपन हो जाते हैं, स्किन की जो पोर्स है वो ओपन और वाइडर हो जाते हैं, स्किन के जो पोर्स हैं वो ओपन और वाइडर हो जाते हैं, और उसके थ्रू ही हम फिजियोलॉजिकल इफेक्ट कपिंग के अचीव करना स्टार्ट करते हैं हमारे ट्रीटमेंट के लिए। इसलिए स्किन शुड बी मॉइस्चर फ्री, पसीना नहीं होना चाहिए, वहां पे डस्ट फ्री होना चाहिए, एकदम साफ होना चाहिए, हेयर फ्री होना चाहिए, क्लियर। बहुत टाइम तक लगातार कप को यूज करते हैं, क्योंकि अब हम ऑयल यूज कर रहे हैं तो बहुत टाइम तक जब हम कप को यूज करते हैं तो इसके अंदर भी ऑयल लगता है, हालांकि हमको हर कपिंग के बाद में कप को टिश्यू पेपर से साफ करना होता है, लेकिन क्या होता है रिपीटेडली जब हम कप को यूज करते हैं तो क्या होता है, इसके अंदर क्या होता है, ऑयल जमा होना स्टार्ट हो जाता है, तो इसकी जो ट्रांसपेरेंसी है, कप की जो कप की जो ट्रांसपेरेंसी है, कप की जो फाइन। सो लगातार ऑयल यूज करने से क्या होता है कि कप की जो ट्रांसपेरेंसी है वो खत्म हो जाती है ना। तो जब कप की आपको लगेगी कप कप की ट्रांसपेरेंसी अब बहुत कम होगी, क्योंकि कितनी वैक्यूम की वजह से कप के अंदर कितनी स्किन लिफ्ट होती है ना, कितनी स्किन पुल होती है वो हमें देखना होता है। तो अगर वो अब हमें नहीं दिख रही है तो वो हमें नहीं दिख रही है, फर्स्ट पॉइंट। दूसरा, जो ये पेरिफेरी की मैं बात कर रहा हूँ, लगातार कप को यूज करने से अगर ये पेरिफेरी घिस जाती है, खुरदरी हो जाती है, रफ हो जाती है, तो ये जब 2 पॉइंट अगर हैं तो उस जब ये 2 पॉइंट अगर आपको मिल जाते हैं उस टाइम आपको उस कप को डिस्कार्ड कर देना है, यानी कि उस कप को आपको अब और यूज नहीं करना है, उस कप को आपको अब और यूज नहीं करना है, इट्स ओवर, फाइन। हाँ, हम कप को डिसइंफेक्टेड okay. So we are using like for that we can disinfect this cup normally. We can dip in a normal any saline water, disinfected water. We can boil it. We can put this cup once or twice in a week, once or twice in a week in a hot water, once or twice in a week for a hot water just to disinfect it like this. Fine. So this is the basic rules for cupping, how to use it, how to do it, like how to use it, how to do it. Fine. So this is a basic way. Again, no hair. First of all, no hair and all like this. So this is about that how to use the cup and all like this. Fine. Same thing as for cupping gun. Usually it is not easily you can say it's not easily breakable or like that easily discardable. There is only one thing is spring. There is a spring inside it. If the spring is loose, no vacuum is created by this cupping gun, then discard it. Otherwise, it's go for a long time and all, no issue at all, right? So this is the one more cup we have. This is a U cup V shape. I hope you are just checking that you just find out the differences of these two cups. Fine. Differences of these two cups. This is an entirely circle, uniformly circle. This is a curve. In this cup, there is a curve inside, in center of two curves, in center of two curves are there. Basically we known as, this is a U shaped curve. It designed for joints, like joints of like a shoulder joint. So it is uneven contour over there. If we apply this kind of cup, normal cup over that, so as I told you the cup should be fit over the body part like this. If we use that kind of cup, so somewhere some part of cut is not touched with the skin, so vacuum is not created properly. That's why this cup is designed for easily fitted over the shoulder joint or like ankle. Most uneven joint, uneven contour, uneven contour of a joint like ankle joint and elbow. So this kind of cup, a U-shaped cup is there. Fine. So it is about like that what is called a basic cupping, how to different what about the cup parts, how to use a cup, what are the different cupping and all. There are multiple way of cupping. What I am saying, multiple way of cupping means that, as I told you, dry cupping and wet cupping, fine. Static and dynamic, how to use it, how to create a vacuum, it depends on static. How to create a vacuum, fine, it depends on soft, medium and hard cupping. Soft, medium and hard cupping, fine. Then we design multiple way of cupping. As people like me, I am doing research on my patient and all, keeping on that mix and match. I am doing this thing and all, fine, like medicinal cupping, ice cupping, heat cupping, electrical cupping, fire cupping, and then again mix and match, intermittent cupping. Intermittent cupping, we have an instrument also for the intermittent cupping. We can create intermittent by our cupping gun also, like this. Multiple way of cupping, but basic is dry and wet, static and dynamic. Dry and wet, static and dynamic. These basic. Now I'm just one more thing I will discuss with you about the physiology. This is the most important part. How? See, it's not like that. Okay, like I am talking to you about the cupping. Okay, fine. Cupping is doing this. Cupping is doing that. Someone in Egypt people, China people are about asking about that cupping and all. Okay, fine. Okay, fine. But we need a logic. We need a logic. How does cupping work? So who will which point will explain a physiology? A physiology. Fine. Where we apply the cupping, over the stiffness part, over the joint pain, tightness, muscle tightness. What happened then? A muscle will accumulate over to muscle fibers which will accumulate. That means what they are cross bracing, wrong cross bracing. Fine, they become tight. Fine, lack of blood supply. Fine. So as we apply cup over the skin, what happened that it will pull the skin part, adhesion part. It will pull the adhesion part under surface free. It will pull the epidermis, dermis, fascia, and all. Fine. Under surface, inside the part, main muscle parts become free with the adhesion. Even blood vessels also will pull out with this vacuum. Fine. Inside the muscle, at the level of muscle, what happened? At the level of muscle, the part become free, congestion free. So more blood supply over there, more healing is there. So more blood supply, more healing is there, pain reduce and all, and condition free, stiffness free. As with the dynamic cupping, it will release it will stretch skin, fascia, muscle itself. So what I am saying, as we apply the cupping, it will it will pull out the stiff part, tight part of that muscle and all. Inside that tight part is congestion free. Now blood supply is more, muscle fibers become easy, you can move with it. So this is the basic physiology how the cupping does work. Now the question is how the cupping reduce the pain. How the cupping reduce the pain? Simple pain gate theory, as we discussed a lot of time. You studied in your bachelor's or master's or whatever your physiotherapy education programs. You have discussed the pain gate theory. But the pain gate theory, whatever you have discussed in your BPT or master's time, is all related to your electrotherapy, right? Where we talking about A delta and C fiber, this fiber and that one, mechanoreceptors, noxoreceptors. Definitely the things are over here also. Okay, fine. So mechanoreceptors are there, mechanoreceptors, noxoreceptors are there. Fine. But what about here? What about here? What about here? How the definitely noxoreceptors are there, which is responsible for pain, which give the pain to us. They will stimulate with the chemical release and all. But here we are creating a negative pressure. We are creating a negative pressure. So what is it? We're talking about that baroreceptors, which also attached with the skin joints and all. So when we apply negative pressure, we are changing the pressure. So this, that means external stimulus. What is the external stimulus? Is the pressure. Who will sensitize for that? Baroreceptors, where A beta fibers and all is to all attached over there. Now it will signalize to the spinal cord, to the higher cortex center. Then the pain is stopped. So this is the how the cupping works on pain gate theory, and how it will stop your pain gradually in days. It is a so fast technique. It is a so fast technique of pain relieving in one sitting. In one sitting it will relieve pain. Yes, it will relieve pain. The basic demo I will just start in 5 minutes with video people. You will just get idea. Okay, fine. I will give you the not basic. It's not like the, okay, fine, applying over back. No, I will give you I will apply over one muscle or one joint, so you will get an idea. Okay, fine. A most common muscle on that muscle, which is normally affected each and every person in young to adult. It will causes a pain. It's a very mysterious kind of thing and all. So this is about how will started the cupping, how do the apply the cupping and all. Fine. So this is a way cupping and all. So this is a basic thing, like division and all, and all like this. Fine. As for that, I am talking about that on the 25th of this October, Sunday, 1 p.m. to 3 p.m. I am. Again my session. It's a paid session. It's a paid session. I am talking about. I will talk about electrical cupping and fire cupping over there. There's a huge differences. It is a huge thing. Electrical cupping is something different. It will give a it is when you learn electrical cupping on, maybe it's all your wish, on 25th of this October, 1 p.m. to 3 p.m. It is a you will add one special tool in your physiotherapy armory. Yes, definitely. It's my promise to you. Well, I will, I am assuring you right now, after 5 minutes, whatever I will demonstrate you from tomorrow onwards, when you apply on your patient, definitely you will give a good results to your patient. Yes, yes. I'm talking about, see, keep one thing. I will give a demonstration over a one particular muscle or one particular joint. Don't be think that, okay, the same pattern we can apply all over the muscle, all over the joint. No, no at all. No at all. It's not like that. It's not like that. Fine, fine. Just a moment, just a moment, just a moment.
So we are just taking a 2 minutes break, and then we will move ahead with the demonstration session. So please, everyone, have some patience. We'll just start in 2 minutes. So, how many guys are attending cupping workshop for the first time? You can post in the comment box. How many people are there? How many actually practice that? Anyone in the comment box? Anyone who does practice cupping therapy? Please tell me who is practicing cupping therapy right now? Anyone who has no idea about cupping therapy? Yeah, anyone? So, first timer, lot of first timers, lot of questions also. Definitely, we will take the questions once the session is over. Sir is preparing for the demonstration session. Once the session gets over, we will definitely have a, question answer session as well. Yes, we are taking a lot of questions. There are a lot of curious people who are asking questions. All these questions, everything will be taken once the session is over, once the demo part is done. And definitely, okay, somebody is using cupping therapy. So, Pragati, how do you feel? What exactly is cupping therapy helpful? How often are you using it for your patients? What exactly do? Please share your experience in the comment box only. Yes, yes, learn more. Definitely. Uh, Definitely, we will be taking all these questions. Sir will be definitely taking care of your doubts as well. We'll just wait for the demonstration session. I think Sir is will be back in just 2 more minutes.
Yeah.
Yeah,
Yes, I am there.
Sir is back. Now we
Definitely.
will start with demonstration. Yeah.
I am just arranging for demo. Yes.
Yes, sure. Please, sir, take your time. I'm just interacting with all the viewers and all our participants.
Yeah, definitely we will keep the question answer session. Definitely, without it, the everything is not complete.
Yes, sir.
Right. Whatever you can ask, because it will, it will good if you ask something to me. Maybe on the basic I forget maybe one or two points. It can be possible. Fine.
Hmm.
So you can ask, so I can just elaborate that point also. Fine.
Yeah.
Okay.
Yes, guys, tell me. So I think sir is back. Lot of first timers. It's nice. It's good to see a lot of people joining for the session, trying for the session. It's nice. Yeah. So I think we are ready for the demonstration session. And yeah. So we have the model. So we are ready with the demonstration session. So your voice is not clear. सर आपका आपका mic बंद है. Yeah.
Okay, fine. I am just talking about that trapezius area. I hope this trapezius till shoulder is visible to all of you.
Yes, sir,
Fine.
it's clear.
The, okay. So as I talk to you, like I will just give the demonstration of the one particular muscle. That muscle is trapezius. Each and every person is, you can say, a morning is a catch in the trapezius. They are what they getting upper fiber of trapezius very, you can say, that will create a lots of problem in future like this, fine. So I will just discuss with you how to use a cupping static and dynamic for trapezius muscle. There is one add-on. Okay, fine. One add-on for you, all of you, for that, a specific technique for trigger point. I am usually it is a basic, but it is my, you can say, I am very, it's my passion to teach teaching is my passion, so I can't resist myself to give or imparting my skills to other. However, it is a very basic session. I will discuss the trapezius muscle with you with the static and dynamic cupping. And one more add-on is it, how can you play with the trapezius trigger point with the how can you play a trapezius trigger point with the cupping? How can you get rid of giving the treatment for that trapezius trigger point? And I will discuss the trigger point of trapezius. Fine. Okay, fine. As I discussed, as I discussed with you. Okay, fine. So, you know what? This is the entire trapezius muscle. We started from this side to going down, down. So, I'm talking about the static and dynamic. So, just ask the patient which area is, just do the palpation. Just do the palpation and ask the patient which area is tender. Suppose this area is tender. Fine. This area is tender. First of all, I will clear one thing is my habit. You can say like that. Trapezius is what? What is a shrugging? Is do the shrugging of the shoulder as we always discuss about the shrugging of the shoulder. But no, no, it is an indirect movement of trapezius. Trapezius is inserted on the posterior surface of the clavicle. So how does it create a movement of the scapula or shoulder? So when the trapezius work, when the trapezius work, so what happens? It rotates the clavicle posteriorly. So through the acromioclavicular joint, the scapula goes back. Retraction. As we discussed, so main action of trapezius is retraction, and again is shrugging. Suppose this is the clavicle, like as the trapezius move, this rotate posteriorly, so it pull the clavicle acromion muscle up. So we are saying shrugging of shoulder. Is rotate posteriorly, so it shift the scapula posteriorly, so it is called retraction. Why I am discussing with you about this chief the basic biomechanics of trapezius. Whenever when you apply a treatment, or maybe you apply a hot pack over the trapezius muscle, keep one thing, just retract the scapula, maintain this retraction position entire treatment session of upper fiber of trapezius. Same here we are same here what I'm doing, I'm just keeping that. Same here, I am just keeping the trapezius, sorry, scapula in retracted position. Fine. And neck slightly rotated opposite side and looking forward, exactly, not exactly downward. Now, as I am going to palpate the trapezius muscle, suppose this point, I am just right now I am discussing with you a normal thing. Right now, I am discussing with you a normal thing. Normal thing means a normal basic cup how to apply it. Suppose this is the painful area. Okay, fine. So up how your choice in between static and dynamic. Suppose only this localized area is painful. I am my select. See, these are use points are there. Multiple points are there to select static and dynamic. But right now, just for basic, what how to select right now in this webinar? If suppose localized area is affected or painful, right? So your choice is static cupping at least for 10 minutes. You should park your cup over that painful area. But in case but in case when the entire muscle is painful or patient is not able to describe, explain his or her pain to you, okay, fine, sir, this point is painful, so my entire area is painful. The your choice is instead of using 2 or 3 cups, static cups, it will give a cup mark. So you should use a dynamic cupping again for 10 minutes continuously. Fine. Fine. Or definitely in this retracted portion of scapula, and it's my assurance to you, I am assure you, just after finishing complete of your treatment, just after completing of your of treatment, the pain at minimum 80 to 90% is rid of, is goes, is went. No more pain over there. Patient feel easy. Definitely cupping soreness, post cupping soreness. Yes, one more thing. Post cupping soreness is there because of we pull the cup muscle for at least for 10 minutes. So just clear cut instruction for each and every patient after cupping. After cupping, just applies ice, only ice. 3 to 4 sessions of ice in house, home treatment. So any tenderness because of pain, because of cupping is there, because of cupping is there, it will, you can say released, or next day is easier for you to apply a next treatment session. Fine. You know what? You assess first day. I'm just basic thing I will discuss with you. You will never found in any book, whatever is there. On next day, like you apply today, very first day of cupping therapy to the patient and all. Definitely that particular area. Suppose trapezius is there, opposite movement, rotation, and side bending is limited, painful. But once you apply the cupping, so what happened is you apply the cupping over there. Cup marks are there, heaviness is there. That particular point is tender because of you hold the muscle for 10 minutes in vacuum position. Fine. When what? Just listen carefully. When next day patient come to you, what you will ask, what how are you, how your pain and all. So it's okay, I feel good and all, but my this area is too much tender. When I touch this part of my part is creating a pain, is doing pain over there. Fine. So okay, what about your movement? So it's good, it's free. Yes, yes, this point means a cupping does its work, cupping doing its work, cupping did its work. What work? Is increase range of motion related to that muscle. No doubt at all that particular area where we applied cup is standard. Because of that, we give instruction or advice to the patient, use 4 to 5 times 4 to 5 sessions of ice pack or ice cube massage at least for 10 minutes or 15 minutes over there, just to relieve the pain and all. This basic thing and all. Fine. Clear. Suppose this particular area, so I hope you just listen carefully my previous comment, my previous statement, that how to use a static and dynamic. If the localized pain is static, is generalized pain in area is more, you can go for the dynamic cupping and all. It's clear. Fine. Now don't I'm just talking about the trapezius muscle. I just give that retracted position. I just clear the trapezius muscle, position of trapezius, retracted of scapula and all. Now I'm just discuss about common points. This is the way. See, we are pulling something out. We creating a vacuum. So we are pulling something inside the cup. So our main aim is we should not push our cup downside. We should not push our cup down. Push our cup inside the muscle. It is wrong because we are pulling, we are creating vacuum. So we are holding the cup in such a way that we are holding a cup in such a way that simply without applying any force. Fine. Then we pull the vacuum gun over there and apply the cupping easily. Now how to release this cupping gun? Hold the cup, rotate the gun and pull it out. If you are not doing like this, or you want to pull it, you want to release the cupping gun by pulling it, is wrong. In suppose in acute phase, tappage is always in acute phase, creating a pain. Okay, fine. Just release, just hold the cup, release it and pull it out. Fine. The another way is, instead of applying cup over there, you just prefix the cup with the cupping gun, prefix the cup with the cupping gun, apply it over the treatment area without any pushing downward, and apply the cup again, hold it and rotate it and remove it like this. Fine. This is the basic process of how to apply the cup. Now, how after treatment, how to remove the cup after treatment. This is a red. As I told you, this is a valve. You just pull it, vacuum release, keep it there. Is a way of removing. One more thing I will discuss with you in 10 to 15 minutes session. If you are using a static cupping or you apply a cup for 10 minutes, what happened that when you apply cup for 10 minutes, this periphery of cup is periphery of cup making an impression with the skin. That means what, it fixed with the skin. So after 10 minutes, what happened that it's not easy to remove the cup. Like what I'm saying, after 10 minutes or 15 minutes of static cupping session, the periphery of cup make a mark or some impression with the skin. So what, so it's not easy to remove the cup after 10 to 15 minutes. So what we are, so as we remove the cup, as we pull the valve, okay, fine, still cup is attached with the skin because it's making an impression. So don't pull it, don't try to pull it, wait for a while, automatically it will release a vacuum and fall down, or it will, you can remove easily. Or you want to remove more fastly, just tilt the cup, just tilt the cup, just tilt the cup and move it. Just so this is the way how to remove the cup, how to apply the cup. If you have doubt in this point right now what I discussed with you, you can ask after the question answer session. I am not repeating again, I will move forward. Fine. So if you apply a static cupping over that localized pain, so this is a static cupping. Right, fine. If you have, if patient complain to you, sir, it is a generalized pain from here to here, it's a generalized pain from here to here, right? So what you have to go for that dynamic cupping along the course. First choice should be along the course of the muscle. First choice should be dynamic cupping along the course of the muscle. What is the course of muscle? The length of the muscle. Doesn't matter origin or insertion. I am not discussing with you about the origin insertion pattern. It is there, but it's making confused right now because I am not with you there to correct yourself. I am on the on online session is there. So I am not right now. I am not discussing with you that origin to insertion or insertion to origin. Forget it. It's same right now. It differences are there, but it's same as on we are on online. I can't hold you your hand or correct over there, right? So if patient complaint of, is patient complaint of entire muscle is fine. I am talking about my, talking about right side trapezius. Okay, so what happened that when the right side trapezius is there, so left side bending is limited. Clear? So just actively how much left side bending is done by a patient, hold it, don't go for over bending, otherwise stress reflex generated, it create a double pain. Fine. So as active patient, how much bend is there? Just hold. I'm talking about trapezius. Keep it in mind. So don't go for excessive bending with your hand passively. Otherwise, it creates a stretch. Reflex is a basic physiology of muscle. It will give a double pain over there. Okay, fine. Now I will start. This is the transverse process area. I will keep my cup over there. Fine. Apply the one stroke of cupping. Listen my words carefully. Listen my word. The good listener or good watcher is create miracles. Is like that. Fine. So I am giving a one stroke. I am giving a one. I am giving a one stroke with the vacuum gun. Keep the keep the shoulder retracted, bend the neck, opposite side bending. Now start the, now start the dynamic cupping over that particular area like this. Come up, come up. You can go for the till entire muscles of the belly. Come up like this, like this, like this, like this. See, look at. Fine. Entirely you are moving like this. As I discussed with you, The cupping has two parts, dry cupping and wet cupping. Okay, dry cupping and wet cupping. Again, I'm not talking about wet cupping. Again, dry cupping two parts, static and dynamic. Again, for soft, medium, and hard cupping. Same as dynamic cupping. Again, is two parts, slow and fast. Slow and fast, that depends on patient condition. You will decide a slow cupping, or suppose it is simple. Slow, this is a slow cupping, this is a fast cupping. Your fast rubbing, it will create a erythema reaction, redness over there. Don't worry about it. It is a slow cupping, it is a fast cupping. Slow cupping and fast cupping. It is about what is called. It is about what is called qualitative. It's not quantitative. How much repetition, how much fast? Because my slowing is different from your slowing cupping, dynamic cupping. My fast dynamic cupping is different from your fast dynamic cupping, but it is fast or it is slow. Remember, cover the entire length of the muscle. Trapezius is like this only. If you're talking about hamstring, we have to move the bigger area. So maybe you can use the two cup. Maybe you can use a two cup to and fro. Maybe use it when we using a two cup. When we using, I'm talking about hamstring. Trapezius is small cup. The one cup is sufficient. If suppose quadriceps hamstring video or back video, you are using a two cups simultaneously. Two cups simultaneously. Fine. This is alternate method. Alternate method. Hold. See. Look how I am holding the cup. I am holding the cup with the body of the cup, trunk of the cup, because as I discussed with you, we are not we supposed to not apply a pressure, downward pressure. If I'm holding the cup like this, definitely while moving the cup duly or unduly, I can push my hand downward or giving the wrong. Fine. So hold the cup like this. Keep your shoulder apart, free. Keep your body free. Move it for the bigger muscles or for the back pain and all. Clear? Fine. So is a slow dynamic and fast dynamic along the course of the muscle fibers. Abhi, I am not discussing with you from origin to insertion or insertion to origin, just slow dynamic. It is fast dynamic, maybe differ from you, maybe different from you. Is like that. I am just discuss one point with you. You know what the grading system, grade one, as a quantitative method, I am talking about is a quantitative. Sorry, it is qualitative. It's not quantitative. How much repetition is there of the moving cupping? Like, so what? As in grading system, grade one, grade two, grade one for you is something different. Grade one is something different for me. You know that is something different for me. It's an entire different session, as I discussed, talking about you and differently. So same as here. Fine. So it is about that static, slow, and dynamic. Fine, slow and dynamic. Sometimes what happened? Sometimes now again key point I am discussing with you. Sometimes what happened that as you start your dynamic cupping, see, sometimes dynamic cupping creates a miracle. Yes, over static cupping. Sometimes static cupping is, you can say, it's not giving a benefit to, not benefit, it's not work sometimes, but dynamic cupping is work. So maybe your choice should be first dynamic as compared to static. The multiple reasons are there, but try to go for first dynamic because it cover the entire muscles. It release the skin damage, it release the fascia, it release the muscles. See, you know the fascia, I'm talking about the facial covering of the muscles. People who are talking about that, I am working on fascia. No, not at all. Not possible. Not possible. Because how can you calculate, how can you quantify I'm working on fascia? How much pressure you, how much amount of mercury pressure you apply which work on fascia? Is it there? Is it there? No. No. Keep your mind open. Keep your mind open. How the people are doing, how the people are doing, how the people are saying I am working on fascia. Hello. Hello. How is possible? If you are if I am wearing a tight sleeve t-shirt, fine, it is, how can I move my joint? How can I move my joint? How can I move my shoulder? It is my shoulder having a problem? No, my t-shirt having a problem because it is a fascia. How there is a no calibration, how much force, how much pressure, mercury pressure you applied, which work on fascia, how much stroke I am giving as a MFR is work on muscle of fascia. No, it's not like that. It's work together. All things work together. Even you are giving mobilization, it will work on muscles also, because pressure goes through the muscle, through the joint, like this. It's clear? Okay. So what I'm saying, this is a slow dynamic, this is the fast dynamic. Sometimes what happened that when you start the dynamic cupping, when you start the dynamic cupping, the cup will not move easily. Sometimes it depends on skin texture, person to person. The cup is not moving. So what you are doing, you tilt your cup, you bit off, tilt the cup, you just tilt the cup in the you tilt the cup in the direction of moving, in the direction of movement. Like I am moving downward, I am moving toward the shoulder, so I tilt the cup like this and start the moving. I am just releasing the vacuum, bit off. I am just releasing the vacuum by tilting. I am just releasing the vacuum to make dynamic cupping more easier. Remember, one more point should be remembered over there. You should not apply a cupping therapy, maybe dynamic or static cupping over the bone, directly over the bone. There are few body parts like shin, tibia, tibial shin, fine, lateral epicondyle, fine, carpal's area. Fine. So this is the fine. So we doing like this. Fine. So all that will cause the periosteal pain. That's why I am avoiding over that particular area. So this is the slow and static and all. One, as I promised to you, I will just discuss with you the trigger point. Fine. Suppose this is the trapezius trigger point. You know what the trapezius trigger point give the pain over that backside of the ear, occiput area, and sometimes in front above temporal. This is the frontal bone just above the eyebrow, this area. This is the trapezius trigger point refer point. Whatever I discuss with you for the trapezius static or dynamic cupping is work. It work also for trigger point, but exclusively you want to give a treatment of trigger point. What is it? You just apply a painful static cupping over painful area. You just pull up. You just I'm talking about trigger point. You just pull vigorously. You pull the cup. You rotate it. You move clockwise, anti-clockwise. You move it like this. Fine. You move it like this. You can rotate it, move it, zigzag, any pattern. Fine. Again I am repeating. You just for trigger point apply the static cupping over trigger point area. After that, you just pull it, your cup, you just pull your cup, rotate clockwise vigorously. You can, yes, this is painful for the patient. You rotate it clockwise, anti-clockwise, fine, to and fro, to and fro, to and fro. You can move it like this, fine. So this is the way. This logic is only for physios. People who design cupping initially, they don't know about it. Okay, fine, we are doing cupping for trigger point like this also. Fine. From where we got this technique? We got it designed by me. This technique of trigger point, like pulling, rotating, after applying static cupping or trigger point, pulling up, rotate, zigzag movement and all, at least for 5 to 7 minutes, at least for 5 to 7 minutes. Fine, at least for 5 to 7 minutes we applied it. I designed this technique. This idea came in my mind from my basic first year, where we are doing something with our hand. over the muscles. I hope you are getting with my action what I want to say. So this cupping for trigger point, whatever I'm doing, pulling, rotating, clockwise, anti-clockwise, zigzag movement, is come from my basic physiotherapy for my first year. What I learned with my experts, my mentor. Fine. What is it as we learn in the life? This is called. Fine. I hope I will not utter my word over here for what is it. Fine. This is something. This is a copyright right now for this session. Okay. Fine. Fine. So this is about a basic idea how to apply that cup and all, and this is what. Fine. Clear.
Okay. Sir, thank you. It was a very nice demonstration session. And everybody in the comment box is really excited. They learned a lot of new things. They have been, discussing about a lot of things as well. A lot of people who have attended this session for the first time, and very few people who are already trying and who are already practicing cupping. So sir, there are few questions. Lot of questions you have already answered in your basic session. A lot of logics, lot of theories you already have given. So still there are few questions left, which definitely I will put forward. So sir, somebody asked, and it's a very important question. Once I applied cupping. After some time, I saw his skin got ruptured and there was a little bit of blood which came out. What caused this, and is it a bad sign?
If skin got if skin gets ruptured, see, normal erythemal reaction is there.
Okay.
Normal redness of the skin is there. Skin become red or bit of coffee color, brick color is there. It is a normal sign. It is
Okay.
because we hold the particular part for at least for 10 to 15 minutes under vacuum. So blood will come superficially. More blood will come superficially. It will take time. Sometimes it will take 1 day initially to get settled down. Fine, the blood will get settled down. That's why I suggest you just instruct your patient to apply 3 to 4 sessions of cryotherapy. Fine, that's why.
Okay.
But skin rupture, blood will come out. Fine, it is wrong. It will not. It is not in cupping. The maybe the reason behind it, you are not learn the things properly. You are newcomer, you are beginner. Maybe you learn this technique in any workshop under the experts. Sometimes it happen. If you learn under some experts, or it will happen like skin is breaking, blood will come out, that means you are choosing wrong thing. You are not diagnosed properly. You are not decided static cupping should be applied or dynamic cupping should be applied. How much vacuum is there? As I discussed with you, there is static cupping for the three parts: soft cupping, medium cupping, and hard cupping. It will decide how much vacuum is there, as because it is qualitative, it's not quantitative. So it's a lots of points. But yes, a screen is break, a screen become break, or blood will come out is a wrong sign. Stop treatment. Some of my students, even sometimes I got the blister formation is there.
Okay.
Small blister is there. So small blister is there. It's not a side effect of cupping. First of all, it's not a side effect of cupping, right? It is a patient skin texture, skin condition. Like someone having a very small, thin or shiny, skinny skin is there. Maybe a chance is you are applying cupping in humid area, sweat area. That's why I give the basic instruction: clean the skin, no hairs over there, dust free is there. If you are measured, if you are doing this basic thing, so this will not happen. Yes, but skin rupture is not. It is really it is a stopping sign for
Session.
till healing is there.
Okay. Sir, how is hijama related to cupping therapy?
Yeah. See, Hizama is something different sign. Dry cupping. See, dry cupping and wet cupping. Dry cupping, as I discussed today, basic about it in Hizama. and wet cupping, we land the blood inside the cup.
Okay.
We giving the surgical incision. We have a surgical blades with us. The
Okay.
surgical blade which is available in the any medical store. Fine. We used it. We applied the cut over the treatment area. Again, I am speaking bit of about hijama as sir asked to me about the some query of someone. So whatever what I am saying, please don't start from tomorrow onwards. Okay यार क्या है हिजामा में कल ही कर देंगे इसको तो. No, please no, please no. It's not my responsibility if you are doing some blunder or some miracle maybe. Okay, fine. So please, so hijama is we are giving us see, hijama is a Islamic or you can say a technique. They are experts. They are something related to mythology also. Definitely, it's yes. But once you expert in hijama, it's great. Is give a instant results. Instant results. Okay, fine. I will discuss one of my Delhi workshop organizer. I am working with them for the last 2 to 3 years. In 2019 or 18 January, he has a tennis elbow. He is a good dry needling practitioner. फाइन सर मुझको ऐसा हो रहा है आप मेरे को डेमो बना दो मेरे पे हिजामा कर दो आई अप्लाइड हिजामा ओवर देयर वो दिन है आज 1.5 2 साल ओवर आज का दिन है नो रिकरेंस ऑफ टेनिस
Okay.
नो रिकरेंस ऑफ दैट मच इफेक्टिव हिजामा बट हिजामा में हम क्या करते हैं सर्जिकल इंसिजन वी आर गिविंग द सर्जिकल इंसिजंस विद दे आर स्पेसिफिक टेक्निक टू गिविंग इट ऐसा नहीं कि उठाया और किया
Okay.
यू नो
Okay.
बहुत से लोग वो लैंसेट यूज करते हैं डायबिटीज वाला
Okay.
ट्रिकल करने के लिए ना जो
Uh-huh.
अपन ब्लड टेस्ट दे
Yes,
आर
sir.
यूजिंग इट
Yes,
नो
sir. Yeah.
प्लीज इट इज नॉट हिजामा इट
Okay.
इज नॉट हिजामा
Okay.
इन अ रोड ट्रैफिक एक्सीडेंट ब्लड विल कम आउट इट्स नॉट
Okay.
हिजामा इट
Okay.
नॉट हिजामा राइट
Okay.
यस
So next question, what are the contraindications, major contraindications for cupping therapy?
See, there's a no basic major contraindications is cupping. There's a see contraindications are two type: absolute contraindications or contraindications. Precautions, fine. There is a no absolute contraindication. Yes, one absolute contraindication is skin infection, skin allergy.
Okay.
Is someone having a skin allergy, someone having an infection, like someone having a eczema. Simple, simple, fine. Don't if having there, so we can apply it, but in precaution way. We disinfect our cup after every session. If someone having a wound, open wound, but not contaminated, if
Okay.
contaminated is there, stop. No,
Okay.
because his medical history suggests it's contaminated or not. So, but otherwise, cupping gives a fast healing in wound.
Okay.
You applied it.
Okay.
Where applied it? Again, at the periphery of the wound, not
Okay.
over the wound, at the periphery of the wound. Or
Okay.
once more thing, if someone in my all workshop, my student asked me, so what about diabetes? In diabetes, if simple diabetes is there, no problem at all. But diabetic neuropathy is there. Because of diabetic neuropathy is there, skin sensation lost, you should stop it. No, because how much pressure is applied, he can't sensitize it for that. So that's why before each and every patient you check the skin sensation also as a routine process. Right?
Okay. Okay. So I think we will take the last question for today. Somebody asked, what is the, can we use static and dynamic cupping in one session?
Yes, we can use the static and dynamic. Yes, yes, very good. I think is the question came for this question is very good. Yes, definitely. Or this question came from I don't know who asked this question, but yes, whoever asked this question, he or she is using precisely the cupping.
Okay.
Because of this basic session, no one can ask that kind of question. Yes, we can use in a single session static and dynamic cupping, but
Okay.
remember, if you have a 10 to 15 minute session, usually we are applying that cupping over there. But
Okay.
remember, not 10 minutes exclusive for static or 10 minutes for dynamic. No, you can divide 15 minutes session or 10 minutes session for static and dynamic.
Okay, okay.
Like this. Yes, we can do it. No problem at all.
Okay, I think, sir, this is the all questions which we already. I mean, this. I think this is the last question because we have a time constraint. I would also like to announce that sir is doing a 2 hour session webinar on cupping. A lot of people are asking me what is wet cupping, what is dry cupping, what is fire cupping. So all these doubts have been. Sir will be taking care of all those doubts in his session, which is conducting on 25th of October. Yeah, is it right, sir? 25th of October?
On 25th of October,
Yeah,
1 p.m. to 3 p.m., I
yeah.
will conduct an electrical cupping and fire cupping session.
Okay,
Electrical cupping and fire cupping. See, because of this online session, can't take a 8 hour, 9 hour workshop
yes,
continuously
sir.
online. That's why I'm selecting a those topic which is give benefit.
Yeah,
Definitely, fees is something there is the different issue.
yeah.
But whatever thing I will give you, you can start from whatever day tomorrow onwards and in your practice session and all. Like for Hizama, I am conducting in lockdown period 8 or 9 webinars on Hizama.
Okay,
Okay, it's again is a 2 hour session. On a 2 hour session, we can give a basic to more about Hizama.
okay.
Basic to more about Hizama. People can start Hizama from next day. Definitely, definitely.
Okay, so I would definitely. There is a paid session, and there is a. I would also like to discuss. Sir has already told me, anyone who registers from 10 p.m. today to 10 a.m. tomorrow, only 12-hour window is there. From tonight 10 p.m. to tomorrow 10 a.m., there is a special benefit for those members. There is a special offer for those people that sir will be discussing with you. I will share sir's number on the comment box. The ones who want to register, they have to send an SMS. The timing is very important, right from 10 p.m. to 10 a.m. tomorrow only. This offer is only valid for next 12 hours, only for the people who genuinely want to learn, who are genuinely interested. There are few seats left. There are few seats left for the physiotherapist, especially for our viewers. So anybody who registered from 10 p.m. right now to 10 a.m. tomorrow, only for a window of 12 hours, they can attend sir's session, and there is a special offer for them. So please,
Yeah,
I will just
definitely.
be sharing the details in the comment box. You guys can go through it, and you guys can register for 25th workshop. I hope you all enjoyed what sir was, whatever sir could share his experiences in a very small span of time, because cupping is a very vast topic. I'm glad sir could accept, and sir could take a session for us, and it was very nice of him. And sir, I mean, आप कुछ कहना चाहेंगे? Would like to share something with our viewers, please?
Even it's each and every webinar or whatever workshop is important for me. Maybe a small session, maybe is a use 8 or 9 hour workshop.
Yeah,
I am you without any hesitation, hassle free. You all of you, whatever you join today, you can ask me anytime, any doubt. You can discuss with me anything with me. You can give a live video chat with me. Okay, sir, this is patient. I am applying this technique with this. I can correct. I can correct that time. Maybe sometime it happen. Okay, I'm not free on that time. I
yeah.
will say you okay. We'll after half an hour and all. But without any hesitation, you can discuss anytime. Sir is sharing my number. It is my WhatsApp and my normal talking number is there. Fine. So you can discuss anytime with me. Without
थैंक यू
it, I
सर.
am
थैंक यू, इट वाज
yeah.
सो नाइस द वे यू सेड कि आप मुझे कभी भी कांटेक्ट कर सकते हैं, एंड यू कैन, दैट शोज लॉट अबाउट हाउ पैशनेट यू आर अबाउट टीचिंग, एंड हाउ you want to make awareness and create awareness for everyone. Thank you, sir. On that note, I think we will end today's session. I will share your details with everyone, and I'm sure all these people who are asking so many questions will definitely register and benefit from your sessions on 25th. Thank you, sir. Thank you for your time, and thank you for your expertise. Sure.
Thank you.